Right, bangwa. Start na to. So, diri na to sa practical side of nursing care regarding transferring or moving. So, about na ni siya sa kanang move na to sa patient, kay balo na to sila sa bed to wheelchair, or wheelchair to bed, or kaning magtayhengkan. Tayhengkan is changing position like sa bed. Kaya dili man na sila pwede nga, sige lang sila higda nga flat. Okay, basin magka, ano sila, bed source or jokoso ang tawag. So, muna dapat kailangan side lying sila, diri ba sa left or diri sa right. So, basics of physical nursing care, this is common to all nursing care activities. So, confirm the physical condition of the patient. So, be sure to confirm the physical state of the user. So, before ta mo move sa patient, dapat i-ask sa nato sila if kanang okay ra bilang kondisyon, wala ba sila nalipong, or wala ba sila nagluya, ana. Then if lain nilang pamati karon, so muna i-report dayon nato sa medical staff. Then, you must respect the self-determination of the user. So, ating mananghid sa tadaan jud every action nato or every magkaijo ta or mag-assist sa patient, dapat i-inform nato sila nga kanang ay magkuan ta karon ha, magtayhengkan, or tayhengkan o shimasne, ana. So, iguman ana kay mo to sugot gali sila. So, okay, padayon pa, pero kumuha na sila nga, ay, ayaw lang, kay singlain lang pamati or sakit ng lawas. So, muna yun na lang yung mga kung sa purpose at yung buhaton. And if dili gyapon sila masugot, so ayun na lang kung sa. Then, adjust the height of the bed to make it easy to provide care. So, di ba, na may bed, maubos kaayo, so na po ibang bed, taas kaayo sa imuha. So, i-adjust lang siya according sa imuhang kanang sa imuhang asa kadapit taman ba or asa dapit comfortable sa imuha para dili magsakit imuhang lower back. So mo siya kung yun sa self-independent support kung i-support lang nimo ang patient kung dili niya kaya. So kung na siya yung mga butang na kaya ra niya buhaton, so ikubuhat niyo sa iyo. Kung ano siya, mag-ano lang siya. So nursing care related to turning over on the bed. So niya, makita na ninyo show kung video po about ani. So tuck the arms and legs closer to the center of his body to make the base of his skull smaller. So, naka-remember mo sa ano no? Katong sa first na lesson na to about sa body mechanics na ipagamay ang patient. So, ipaana yung kamot, ipa-cross siya ha, then yung tail po, ipa-bend yung knees kay para gamay siya, kay para kung gaan ang patient, kung gamay ang patient, mas gaan siya i-move. Then move the lower back of the user toward the other side of the bed. So this will make the lateral position more stable. Move the legs of the user to a more comfortable position. A wider base of support helps stabilize the posture. So sa ato dito sa Japan, na sila ipamutsok-sok ng mga pillows kay para dili kay hayang pasyente. So para naay mo babag or support. The next is nursing care related to getting up from the right lateral position to a sitting position and the edge of the bed with loose for her legs down. So, magyapon, i-confirm gyapon nimo ang condition sa pasyente, then explain gyapon nimo sa buhaton, then i-adjust gyapon ang bed, then ipainganin nimo siya. So, makita na niyo sa video niya kay para mas klaro. So, naraman mo i-copy ani no, so basahan lang ninyo ang kaning mga gipang sulat. Saon niya pagbuhat. Then, malingkod na ang patient, i-confirm niyo how the user is feeling. So, wala ba siya nalipong? Kaya diba natin katong gitawag na ko before nga, orthostatic hypotension na kung palit nagbarog ang patient, tayo ba malipong, di ba? So, kung malingkod na ang patient, tingnan mo siya nga, okay ra ka, wala ka nalipong, or may ga shimas ka, may is, is nalipong baka. Confirm that both of his or her soles are on the floor. So, nakatamak ba sa floor ang iyahang tiil. So, this will stabilize the sitting posture. So, next is nursing care related to standing up. So, moto lingkod na siya, no? So, ato na sa paburugon ang pasyente. Ano na po na siya. So this is to put the weight on the user's leg of the unaffected side when he or she stands up. So the care worker provides support so that the knee of the affected side will not buckle. How the user stand up with his or her upper body sufficiently bent. This is to prevent the user from falling on the affected side. So, mao man ni ang mahi nga side sa pasyente, dito pud ka nga side mag-assist sa iya ha. So, kung ang mahi, meaning ang mahi ha kay, sa ang mahi is paralyzed. So, kung unsa tong mahi ni nga side or paralyzed ni nga side, adto ka mag-support. Kay, mo may weak niya nga side. So, dili, wala man siya kusog dito nga part. So, dito ka magtindog or dito ka mag-assist or maggunit sa iya ka. So confirm how the user is feeling and how his or her physical condition is. So muna mangutana ka before pud sa patient kung tayo first time pa nimo nga makakita ni nga patient, so tanaw nimo if asa iyahang weak niya nga side or mahi nga side. Knee buckling refers to a sudden giving way of the knee while assuming a standing position walking which can cause falls. So makita na sa niya sa video later. Iusa na lang ako ang video niya. Then next is nursing care related to walking for a user with hemiplegia. So naay duha ka types or manners of walking with a cane. So naay 2-point gait or 3-point gait. Ang 2-point gait is idungan nimo o tikang ang cane, suwe ang meaning sa ang ihungod sa cane ha kay suwe. So idungan nimo tikang ang cane or ang suwe and ang affected side or katong paralyzed nga side, and then after ana kaya dungan na silang step forward no. Ang sunod na po din step is an unaffected side or katong healthy nga side. So man sa 2-point gait. So 1 cane and the affected side, 2 unaffected side. So linumdumin ninyo ha kay magawas po ni siya sa isa. Then 3-point gait. So ang 3-point gait so katulo kamo step. Ang kani kay 2-point gait naman sa paduhara kamo step, ang 3-point gait katulo kamo step. So una is cane, yung imong iuna forward, cane or ang suwe. Then next is ang affected side or katong paralyzed. Then next na po din mo itikang is ang unaffected side or ang healthy side. So permit nila maghuyog ang cane o ang affected side ha or katong weak ni mga side kay bali ang cane man with imong support sa imong kanang weak ni mga side. So the reason why the person first steps forward with the foot of the affected side is that it is necessary to support the body with the unaffected side, which provides better support. So kung asa pud ang mahi sa pasyente, ato pud ka magtapad sa iya ha. So nursing care related to walking with a cane, the care worker stands by the affected side. So ato jud ka always jud ka ato mag-support sa imuhang or magtindog ka sa paralyzed na side. So, either sa kilid ka or medyo sa likod ka dapit niya mag-support. So, if padong pud saka ang patient, mo sa ning buhaton. So, remember ninyo ang rule or ang saying ha nga, good goes to heaven, good goes to heaven, bad goes to hell. So, ang good, pasabot anang good, is ang good niya nga tiil. Kung padong sa siya ka, so pasabot na kung padong ka sa stairs, heaven na siya. So, ang good ni mga tiil mo na una o saka. Pero kung bad gani goes to hell, ang kasabutan ng hell is padong ka ubos. So, kung padong ka sa hell or padong ka sa ubos, ang una ni mo itikang is ang imuhang bad na tiil or imuhang katong paralyzed na tiil or sa patient mga paralyzed na tiil. So, wala na i-remember ninyo para di mo maglibog kung mag-take na mo exam po. So mana ang patient ikaw pud nga care worker kung padong saka ang pasyente adto ka sa likod sa patient. Sa likod ka nga side magtindog sa iyaha kay para mutahay siya atras ba siya. So nara ka sa iyang likod dili siya matuwad dayon sa or mahulog sa hagdanan. So kung naay handrail pud sa kilid mas maayo if gunitan to sa pasyente ang handrail sa stairs. If panaog pud ka, so mana siya, if panaog pud ka no. So mag-una pud ang cane or ang suwe, then ang affected side, or katong bad na tiil, kay padung maka sa hell, so mag-una ang bad. Then next is ang good na tiil. So mogya pud, if naay handrail, mas maayo if magunit siya sa handrail. And mas maayo pud if mag-una kagamay sa pasyente. Okay, what if muha na siya ba? Kasi baka nang siya kadung matumba. So at least nakasatibangan sa pasyente kadung naod. Dili ka mag ano, dili siya mahulog dayon. So going up the stairs, cane, foot of the unaffected side or healthy side, then foot of the affected side, ang ikatulong step. Then if panaog na po, so cane, then foot of the affected side, then foot of the unaffected side. So nursing care related to walking for a user with visual impairment. So kani po mga buta po din sila ng mga pasyente. So the walking speed should be adapted to suit the pace of the user. So dili man kita ang pasyente no. Kay buta man sila. So dili ta magdali-dali. So mag-adjust ta kung unsa ka paspas or kahinay maglakaw ang pasyente. So when the situation changes due to steps, level differences, corners, etc., explain it in advance by talking to him or her. So for example, na may maagian nga hump or stairs. So ingon ninyo ang pasyente nga, uy, naatay maagian nga hump ha or stairs. So tikang na. Hindi mo siya kita, di ba? So ikaw may guide sa pasyente. So basic posture to adapt while guiding the user. So mana magunit ang patient sa imuha diri sa elbow. So, pwede na po ikaw magunit niya, pero mas better if siya mo magunit sa imuha. Then, mo ni ang wheelchair. So, push handle, auxiliary brake, rear wheel or driving wheel, hand rim, brake, parking brake, tipping bar, caster wheel, back support or backrest, armrest, seat, leg support, foot plate. So, dapat makabalo mo unsay mga parts sa wheelchair ha. Okay, para i-drive ninyo sa wheelchair, kamoy magtulak sa wheelchair, makabalo po mo kung sa inyong buhaton. So points to remember regarding wheelchair. So before mo magamit sa wheelchair, i-check daan ninyo ang tire, air, pressure, and the condition of the brake. So tanong ninyo yung ligid if wala ba ni hungaw ang ligid or dili ba flat. And ang brake is nag-work ang brake. Dili ba mo po ang brake. Delikado kayo kung dili mag-brake. Dagan yung pasyente. To transfer from bed to wheelchair, so mani kung magbalhin na ta from bed to wheelchair, confirm the physical condition of the user. So inyo gyapon i-confirm gihapon always. Always mo kung naamoy buhaton sa pasyente, inyo yung i-confirm kung musta siya, kung musta ra yang gibati, ano. Then explain ninyo kung sino buhaton. So for example, mga anak mo nga, ay mabalhin na ta sa ano ha, sa wheelchair, kay mga na ta sa syukudo or sa dining hall, ano. Then, same lang yapon, katong ganina, i-adjust ni mong height sa bed, ipalingkuro ni mong pasyente, then place the wheelchair beside the unaffected side of the user and activate the brake. So kung asa to ang healthy nga side sa patient, dito ni mo ibutang ang wheelchair. Okay, para makabunit ang pasyente. So pareha nga sa picture, no? So ang patient is, ang healthy nga side niya is na dire. So dire ibutang ang wheelchair and gigunitan niya ang pikas ni side sa wheelchair para itindog niya, dili siya matumba. So dapat i-brake po din mo daan, i-activate mo ang brake para dili mudagan ang wheelchair. To support the user's knee of the affected side. It is a fundamental rule in moving a person with paralysis to first move the unaffected side. So muna, if tindog ng patient, so careful lang jud mo ani kay delikado po siya. Diba sin wala ninyo na-activate ang brake mo, iglingkod sa patient, mudagan ang wheelchair, so hayang siya or makalingkod siya sa floor, so sakit ka na sa lubot. So delikado pa iba sin ano pa yung patient anak sa tawagan ni mabalian ba. Then ang foot plates po patong butangan sa tiil, isa ka sa siya kung mobalhin pa ang patient. Ibalik lang siya ang foot plate kung bulingkod na siya. So after a night, makalingkod na siya. So imo gyapon i-confirm ang iyahang physical condition kung okay ra ba siya. Then if i-move na nimo ang wheelchair, so mo tuignon nimo siya gyapon kanang mananghid gyapon kaniya nga uy kanang maadto na ta na. Then dapat ang foot plates i-double check nimo if ang iyahang tiil nakabutang ba sa foot plate. Okay, basin nagsangyad din na yung tiil then dagan na kanu so mabilin niyang tiil or maipit yang tiil. Then dapat iyahang kamot is naa diri nakabutang, wala dito na nabutang sa ligid kay basta mas hangit nga ang kamot sa ligid. Kaya delikado ko sa tanan mo kasi sala kang if dekiro ang patient nga or able ang patient nga mo deactivate sa brake, so yun nimo nga brake o hazuste ko dasay, hazuste ka lang kung ano mo ba, i-unlock niyo ang brake mo. Then, if padong mo saka, if na ay kung saan ni kaning step, so imo lang itamakan ang tipping bar para moangat ang sa atibangan. Then, pull the push handles diagonally downward. So, down mo siya para moangat ang atibangan. The care worker should firmly press the tipping bar with his or her foot. Place the caster wheels on the step slowly and then the driving wheels. So, yung anong lang na siya. Then, if panaugpod mo, stop right before the step and tell the user that he will be going down the step. So, inyo always should mo ingon ninyo ang pasyente kung sa inyong buhaton kung naog na ba mo or saka na ba mo sa step. Ana. Then, have the wheelchair face backwards and put the driving wheels gently down. So, pull the push handles diagonally downwards, same lang yapon. Then, ang tipping bar, tamakan gihapon nimo para makanaog mo. Pull the driving wheels sufficiently and slowly put the caster wheels down. So, kung panaog sad mo sa slope, so when going down a steep slope, tell the user that you will pull the wheelchair backwards. Confirm that the direction behind you is safe. The care worker should stand with one foot in front of the other. So yung anin yung buhaton na kung panaog. Dili ang patient may mag-unahang tubang ninyo kay mahulog yun ang pasyente. Basta mag-una pa nagkaligid dito sa ubos. So dapat kuan ninyo magbali ang patient. Nya kamo kay mag-ano or mag-ano gyapon mo ka magtan-aw mo sa likod kay unsa ninyo pag naog ay unsa ninyo pag kuan basta buong pa lang mo so dapat magtan-aw gyapon ka. So pareha nga ninyo position mo kag nag-side view. So going down a slope with a wheelchair facing backwards is to prevent the user from sliding out of the wheelchair. Sige, mag-ano sa video para dili mo makalimot. Automatic to the side. Wait, sorry. Mahal ito isa. Magkita lang wait ng YouTube channel. So, nahalang taning part 1. Kani sa wheelchair ni siya, magbalhin mo patient.
Stroke is the fourth leading cause of death in Singapore. Stroke survivors may continue to have some form of physical disability after their discharge from the hospital. Thus, they may require assistance to roll in bed, get out of bed, and sit up on a chair. It is important that caregivers know safe handling and transfer techniques so as to minimize injuries to themselves and the patient. This video clip shows safe handling and transfer techniques with demonstrations by a physiotherapist. However, if you have not been taught by a healthcare professional before, please make an appointment with one before attempting this yourself. How to handle the wheelchair parts? For patients who require maximal assistance of 1 or 2 people, buying a wheelchair that has removable footplates and armrests will definitely make transfers easier. To remove the armrest, press the latch and lift the armrest. To put it back, simply push the armrest back into its attachment and ensure that it is secure. To remove the footplate, move the footplate upwards, press the latch and swing the footplate backwards. However, if the footplate gets in the way of transfer, you can remove the footplate. the foot plate back, approach the wheelchair from the side. Fit it into the attachment and swing the foot plate back into its original place. Always make sure that the foot plate is secure before transporting the patient on the wheelchair. Position the chair nearby at a small angle to the bed for transfer. Allow space for the helper to come in. Make sure that there is enough space at the edge of the bed before rolling the patient over. First, place the opposite paralyzed arm on the patient's body and move the arm closer to you away from the patient's body. Next,
Kani siya nga video is kani ang patient ani is dili jud siya dikiro ha. Kanang kailangan jud siya og maximum assistance.
bend the opposite knee. With one hand on the pelvis and the other hand on the patient's shoulder blade, roll the patient towards you. Remember to ask the patient to participate in the activity as much as she can. Next, bring the legs off the edge of the bed. Stabilize the patient's hip with one hand, and with the other hand under the patient's upper trunk, lift the patient up to a sitting position. Your helper could assist you with the patient's trunk. Never lift by putting your hand under the patient's neck. If the patient is sitting too far in the bed, shuffle the patient's bottom forwards. First, lean the patient on the right and guide the left hip forwards. Lean the patient to the left and guide the right hip forwards. Ensure that both of the patient's feet are placed flat on the floor. Place the chair near the patient's strong arm. Ensure that the brakes are applied. Ensure that your helper is ready to help you. The helper will assist you by lifting the buttocks across. Make sure you communicate to your helper how he is going to help you. You can cue your helper by saying 1, 2, 3, lift, and lift upon lifting. Lower yourself to the patient's eye level. Make sure you bend your knees and keep your back straight. Stabilize the patient's knees between yours. To transfer, lean the patient forwards. Ensure that the patient's weight is well forward. Keep your back straight for the transfer. Make sure that your path of view is not blocked by the patient's head. Pivot at the patient's knees. Bring the hips over to the chair. To shift the patient further back into the chair, first lean the patient forward and to one side, with one hand supporting under the patient's thigh and your helper assisting under the patient's hip. Together, bring the hip backwards. Repeat for the other hip. Make sure that the patient is well seated back into the chair in a well-supported upright posture. Finally, ensure that the foot plates are secure.
Right. Sige. Sumoto siya ang kung mag-wheelchair transfer mo ha. The next is kaning mag-change position. Nakita ra?
Ano?
So kani siya is magtayhengkan na siya or mag-change of position. Right. Paspas na kayo sa tunay kuan dito sa English version.
Hi Olivia, it's Leanne, your CNA. I'm going to go ahead and turn you on your side. So go ahead and sanitize my hands. And my instructions are to turn you on your left side. You need to get a barrier towel. I've got 3 pillows. Gonna lock my brakes. Raise the bed to a comfortable working height. So you can do this skill 2 ways. You can use an observer or you cannot. I'll demonstrate it first using an observer. But first, I need to scooch her over in the bed. She needs to go on her left side, which is this side. So I need to scoot her over in the bed first so she doesn't fall off. You're going to do that in 3 steps. I'm going to reach under her shoulder. So I'm going to move her head and shoulder. With my right hand, I'm going to reach under her shoulder blade. I'm going to scoot her over in the bed. Then I'm going to get under her legs and the small of her back. Make sure to use good body mechanics. Okay. Right. She's still a little bit crooked, so I'm going to just move her bottom over a bit. Okay. All right, so observer, if you could stand over here. So I want to make sure she's not going to lay on her arm. So I'm going to go ahead and have her just cross her arms for me. Give herself a hug. I'm going to raise this leg. I'm going to turn her on her side. So the first thing I'm going to ask her is, are you breathing okay? Make sure she's not with her face in the pillow. Grab a pillow. This one I'm going to put behind her back. And this is
Ang pillow sa Japan, di katong murag triangle na para maana ra siya sa likod, ba dili siya yung aming bulky kayo.
going to keep her on her side. Go ahead and lean back into the pillow. Is that comfortable? The second pillow is going to go in between her legs. You want to make sure not just grab somebody's leg, support the joints. And this one is going to go under her right arm here. All right.
Promote siya sa if ano pa, move sa patient. So, walang kailangan ko. Ay, katudeng magsakag naog di ay. Sa cane na po di ay. Makita ang video.
Hi, I'm Adam Brown, and I'm a physiotherapist with Therapia. A cane can be an excellent way to take pressure off of an injured limb or prevent a fall. Today, we're going to cover the use of a cane on flat ground and while climbing stairs. The first thing to consider is that your cane is adjusted to the appropriate height. The handle of your cane should line up with the crease between your hand and forearm. The cane is used in the opposite arm of the injured limb, ensuring a wide base of support for better balance. The goal is to have a normal walking pattern, with the cane and injured limb always moving together. When negotiating stairs, a common phrase taught to patients is, "The good leg leads to heaven and the bad leg leads to hell." This means that the good leg always goes first when climbing stairs, and the bad leg always goes first when descending stairs. As always, the cane and injured limb move together. Start by putting the strong leg on the first stair. Step onto the strong leg and bring the cane and injured leg up to meet it. This cycle simply repeats until you reach the top of the staircase. When there's a railing available, you may wish to take advantage of it. To do this, simply grip the cane with the opposite arm. The cane still moves with the injured limb, and the railing can be used for additional support. Begin by standing on the strong leg and lowering the cane and injured limb to the stair. You can move the strong leg down to meet them. This pattern repeats until you reach the bottom of the staircase. Always keep stairs and hallways in your home free from clutter. When you sit down, keep your cane within arm's reach. Do your best to keep the floor clean and dry to ensure good traction. Your Therapia physiotherapist will be happy to review these skills with you to ensure that you're safe in your home while using your cane. To learn more, go to therapia.com.
So, break sa ako dali, then balik na din to. Save sa anak ko ng record.